One of the common challenges faced by EMTs, especially rookies, is accurately hearing blood pressure readings in the noisy environment of an ambulance. Many EMTs struggle with this task, often guessing blood pressure readings or confidently reporting the same number for every patient. This inconsistency can be due to inexperience or difficulty distinguishing sounds amid the noise. Here are some effective strategies to improve blood pressure reading accuracy. Isolate the patient's arm. Lifting the patient's arm off the stretcher or mattress helps minimize noise transmission. Supporting the arm with your non-dominant hand can also help stabilize it for a clearer reading. Use the bell of your stethoscope. The bell is more effective at picking up low-frequency sounds, such as Korotkov sounds, which are crucial for blood pressure measurement. Many EMTs overlook this feature. Invest in a good stethoscope. A high-quality stethoscope improves sound clarity. Invest in a good one early in your career and replace the diaphragm with a disposable antimicrobial version for better acoustics and hygiene. Turn the cuff upside down. This trick prevents the hoses from bumping into the stethoscope, reducing interference while ensuring the artery markers remain properly aligned. Learn to palpate. If auscultation is impossible, palpating for a rough systolic pressure is a useful fallback. While it's not ideal, it provides essential information when sound clarity is poor. Turn off background noise. Switching off unnecessary equipment in the ambulance can significantly reduce noise levels, making it easier to hear blood pressure readings. By applying these techniques, EMTs can improve their ability to accurately measure blood pressure, even in challenging environments.